the story of Spectrum is a really personal one for me. It's about an opportunity to pursue a passion and also to make a real difference in people's lives. It started over 30 years ago when I was a nurse at Children's Hospital in England, and twins were born. One was normal and one had spina bifida and hydrocephalus. And the mum took the normal baby home and left little Ruth in the hospital. And she lived 3 months, spending her whole time in a hospital crib. So that day I vowed that as soon as I could, I would take those babies home with me to care for them. And many years later, I was able to do that and started to foster severely physically and handicapped children, mentally handicapped children in England. So if we fast forward a few years, I emigrated to Canada and began fostering here. And over that time began to see how really traumatic it was for mums to be separated from their babies. Of course, there are always those babies that need to be in care, but I realized that many of those just really needed support in the home. So how Spectrum actually started was about 9 years ago at Christmas time, when I got a call from a community nurse about a mum with a 4-month baby. She had postpartum depression and she really wasn't doing well. And the nurse really didn't have anybody else to call, so asked if I could help. So I began to look after him for a couple of hours, a couple of times a week, while mum rested, went to the gym, did her laundry or whatever she needed, and very quickly realized the real difference it was making in her life, that she could have this break and get herself on the next part of her journey. And she ended up actually going to CAP, doing a full-time program, and was able to get a job and take care of her little boy. Referrals to Spectrum are on the increase, as is their complexity. As our reputation in the community grows, so does the number and difficulty of the referrals that are made. We've never turned away a mother, and I will never turn away a mother. But lots of these mums need more help than we're able to give right now. More hours a week and for longer. And to do that, we need more funds. So we're always looking to the community for that support. We do receive grants from the city and district, but that's not enough. We need more community input. These services are provided free of charge to both the client and the referring agency. And we want it to stay that way, so we need more help from the community if we're going to be able to sustain the amount of help that we're giving.
One of the things that has been so wonderful for us in public health is to have an agency that is as credible and helpful as Spectrum is to women here on the North Shore. Women who otherwise couldn't afford to pay for someone who could come in and support them in their homes, someone who's a companion and a friend. And many women do not have that kind of support in their lives. They don't have someone that is close to them, that could be there for them several hours a day, a few days a week, the way Spectrum can. What would be fantastic for Spectrum is if they were able to have additional financial support from the community in order to be able to offer more hours to women during the week. Because for some women, even those 2 hours a few times a week is still really not enough to be able to care for their children in the way that they would like.
I was referred to Spectrum by a visit that our whole family made to the hospital because we were all really sick with the flu, and I think even my partner had pneumonia or something, and we just couldn't take care of our boy, and there was no one, and Spectrum came in and helped us, so made a huge difference. My kids loved Joanne and Rachel, like just loved her, and she just so wonderful with the kids. And just the amount of support that I got from Joanne the second time was just huge, because at that time my life was going through a lot of just really like relationship stuff and like financial, and a lot of really challenging times, and Joanne was there every time. And I remember calling her like on a Sunday crying, and she came right over to my house that day and was a huge source of emotional support for me. I was very fortunate to have this level of support, because it really does take a village. It really does. Like, doing this alone and not having any kind of support, it's very, very frustrating and very emotionally overwhelming. And when you have that level of support and understanding, and someone that's been through it, is just such a relief. It's a real blessing.
I love the part of Spectrum, how we are able to, walk into the homes of these women who have graciously opened up their door to us and entrusted their children into our hands. And so I just see that as a great privilege and honor. And it's been great to be able to practically serve these moms. For example, there are many times when I've driven them to appointments or out to the airport, or even just texting, just to know someone is there is so crucial. We need to know that someone believes in us and supports us. And so that's been a great part of this opportunity that I have to journey with these moms in practical ways. As a support worker, at times it can be a little overwhelming. So it's great that we as caregivers are also cared for well. We have times when we have evenings of training. And also we know that our director, Sally, is just a phone call away, and she's able to walk through maybe struggles that we're having or questions that we have. So not only are we support workers, we are supported as well.
Many of you know that Sally's dream has always been to open a 5 or 6 bedroom house on the North Shore to help our struggling mothers. I also have that same dream, and I'm so happy that I found Sally one day, because before I even knew that was her dream, it was my dream. And I reached out, and it's only been a couple of months, and I have spent some of the most gratifying hours of my life working with Spectrum. The vision that we have for the cottage is to provide longer term breaks for families that are struggling, to provide the break that they need so that they can provide the best care possible to their children. Lots of mothers struggle of all different kinds, and all they need sometimes is a couple of days break. They take their children to the cottage, they're played with loving care workers, tons of volunteers, and then when they're ready to come get them, they come and get them, and the children are happier and the mothers are happier. We are looking to connect with people who want to embark on this journey with us so that we can continue helping make a difference in the lives of mothers and children living right here on the North Shore.